Hello everybody. Today's our topic is classification of mandibular fracture. This is our second topic from oral surgery and definitely the second lecture of mandibular fracture. Now, etiology of mandibular fracture. Sports injury, fall, pathological reason, accidents, domestic violence, fights, physical attacks. मारपीट करते हैं ना आप लोग, बस उसी की वजह से, और इंडस्ट्रियल मिसहैप्स और वर्क एक्सीडेंट. नाउ वी विल गो टू द क्लिनिकल फीचर्स. कभी भी याद रखना, when you write a answer in the exam, you should maintain a pattern of answering. So first you will write about introduction, then definition, and then we will come to clinical features. So here the clinical feature of mandibular fracture, in the there are number of facial fractures occurring. Okay, so the ratio of facial fractures is 6:2:1. Therefore, mandibular is to zygomatic fracture is to maxillary fracture. So, 2/3 of the facial fractures are mandibular fractures, nearly 70%. So, it is very, very common. Now, 6. So, it occurs more predominantly in male as compared to female. This is their ratio. Okay, then statistical number, it could be unilateral, bilateral or multiple. So 50% of the patient have more than one fracture, that is bilateral or multiple. Now, classification. There are various classification for this mandibular fracture. First is general classification, then anatomical classification, then on the basis of completeness, then relation of fracture to the site of injury according to the site of injury, then according to number of fragments, then involvement of integument, shape and area of fracture, then direction of fracture and favorability of the treatment, presence and absence of teeth, and AO classification. These three we will study in next lecture because there is number of explanatory things in it, and today we are going to cover all these things. So first, general fracture. It is also called as Kruger's general fracture. So there are basically 7 types. Okay, first simple, then compound or open, third comminuted, then fourth is impacted, fifth is complex or compound, sixth is green stake, and seventh is pathological. Now, what is simple fracture? Simple fracture is a linear fracture. Okay, so it is a linear fracture which does not have communication with the exterior or the interior. What does this mean? In such fracture, there is no open wound produced. So if there is no open wound, so there will be no communication with the external environment through the skin or mucosa, or internal environment through the periodontal membrane. Okay, for example, fractures in the region of condyle and coronoid and in the ascending ramus. Now, compound or open fracture. This fracture, first of all, this is a simple fracture. Now, compound and open fracture. This fracture has communication with the external environment such as skin or internal environment such as periodontal membrane. All the fractures involving the tooth-bearing area. See, this is tooth-bearing area. Okay, all the fractures involving the tooth-bearing area of mandible where an external or intraoral wound is present involving the fracture line. So example for this is tooth-bearing area of mandible, or if there is intraoral wound or external wound, okay, which is present involving the fracture line. Now, comminuted fracture. In this fracture, the fragments are crushed into multiple pieces. छोटे पीसेस में वो फ्रेगमेंट्स होते हैं, क्रश्ड होते हैं. ओके, दीज टाइप आर जनरली ड्यू टू greater degree of violence. एंड हाई वेलोसिटी इम्पैक्ट. बहुत हाई वेलोसिटी इम्पैक्ट की वजह से और ग्रेटर डिग्री ऑफ वायलेंस की वजह से ये फ्रैक्चर्स होते हैं. एग्जाम्पल के लिए गन शॉट वाउंड्स, किसी को गोली लगी, उसके वजह से अगर मैंडिबुलर फ्रैक्चर हो रहा है तो पॉसिबली इट कुड बी comminuted fracture because it has high velocity impact. Then complicated or complex fracture. In this, damage to the vital structures occur. Complicated or complex fracture. In this, damage to the vital structure occur. So fractures associated with the damage to the vital structures complicate the treatment and prognosis. For example, fracture with injury of the inferior alveolar vessel or nerve, facial nerve and its branches, facial vessels, condylar fracture with associated injuries to the middle cranial fossa. Example के लिए fracture जिसकी इंफीरियर एल्वोलर नर्व, वेसल, ये सब डैमेज हो रही है, फेशियल नर्व और उसकी ब्रांचेस डैमेज हो रही है, फेशियल वेसल डैमेज हो रही है, ऐसे फ्रैक्चर्स इसमें आते हैं क्योंकि इसमें वाइटल स्ट्रक्चर का डैमेज हो रहा है. नाउ इम्पैक्टेड फ्रैक्चर, दिस इज वेरी वेरी रेयर इन द मैंडिबल बट इट इज वेरी कॉमन इन द मैक्सिला. दिस इज द फर्स्ट पॉइंट यू शुड नोट. नाउ व्हाट हैपेंस इन दिस फ्रैक्चर? In this fracture, one fragment is firmly driven into the other fragment. Okay, now green stick fracture. This fracture, a fracture in which cortex of one bone is broken and with the other cortex being bent. So एक साइड क्या होगा, cortex broke हो जाएगा, लेकिन दूसरी साइड क्या होगा, वो बेंड हो जाएगा. ये जो फ्रैक्चर है ये चिल्ड्रन में बहुत कॉमन है, यंग चिल्ड्रन में बहुत कॉमन है, इसलिए इसको इनकम्प्लीट फ्रैक्चर भी बोलते हैं. और ये क्यों चिल्ड्रन में कॉमन है, इसका रीज़न है कि उनमें उनकी बोन ग्रोइंग होती है, सो दे हैव इनहेरिटेड रेजिलियंस, जिसकी वजह से बेंड होता है, वो इतनी ब्रिटल नहीं होती है. नाउ पैथोलॉजिकल, spontaneous fracture of mandible occurring from mild injury or as a result of normal degree of muscular contraction. किसी भी mild injury या normal muscular contraction की वजह से अगर फिर भी fracture हो रहा है, मतलब impact इतना नहीं है कि fracture होना चाहिए, but फिर भी हो रहा है. क्यों हो रहा है? क्योंकि mild injury है या muscular contraction की वजह से, normal degree of muscular contraction. अब ये सब क्यों हो रहा है? That means that bone is very weak. This is because of the weakness. And why this weakness is caused? This weakness is caused due to pre-existing bone pathological processes. क्योंकि पहले bone में pathological processes हो रही थी. Okay, so there is a pathological reason. Therefore, it is called as pathological fracture. Okay, so areas of structural weakness may result from the following things. First of all, generalized skeletal disease. There are two types of skeletal diseases. First is generalized and then localized. Why we are studying here skeletal diseases? Because this pathological fractures occurs because our bone got weak. And why it got weak? Because of the pathological diseases in the skeleton, in the bone. So it is a skeletal disease. So generalized skeletal disease and localized skeletal disease. Generalized skeletal disease like endocrinal disorder, developmental disorders, and systemic disorders. In endocrinal disorder, such as hyperparathyroidism, postmenopausal osteoporosis, old ladies में after menopause osteoporosis बहुत ज़्यादा होता है, जिसके वजह से bone weak हो जाती है and ऐसे fractures हो सकते हैं. Now developmental disorder जैसे कि osteogenesis imperfecta और osteopetrosis. Osteopetrosis has other name called as stone bone. Now systemic disorders such as osteomalacia, okay, it is a softening of bone due to vitamin D deficiency. So when there is deficiency of vitamin D in a body, it can lead to osteomalacia, which causes weakening of the bone, and this can lead to pathological fracture. There are other two diseases called as Paget disease or reticuloendothelial disease. These are considered a systemic disorder which weakens the bone, mandibular bone, and leads to pathological fracture. Now, this was all about general classification. Then we will go to diagram. Okay, see, this is first is simple fracture, which is a linear fracture. Please pay attention, this is a linear fracture. Now second is green stick fracture. This is green stick fracture. In this, one cortex of bone is broken, whereas the other is bent. See, other is bent. This is what's happened here. Okay, now C is compound comminuted fracture. Multiple pieces are here. Now D is compound fracture. Okay, D is compound fracture. Here is a communication to the internal and external environment. Okay, now simple communicated fracture. In the simple communicated fracture, this was compound communicated fracture, this is simple communicated fracture. Many fragments are there. Okay, now anatomical location. According to anatomical location, there are two classifications. First is Rowe-Kirley's classification, and second is Dingman-Netwick classification. According to Rowe-Kirley's classification, there are two things. First, fracture involving the basal bone, and second, fracture not involving the basal bone and fracture involving the basal bone. So, fracture not involving the basal bone are termed as dento-alveolar fracture here, and fracture involving the basal bone are subdivided into single, unilateral, double unilateral, bilateral, and multiple. Now, Dingman-Netwick classification. In this, there are various fractures such as symphysis fracture, canine region fracture, body between canine and angle region, ramus region, coronoid region, condylar fracture, and dento-alveolar region. In this diagram, we will show first is symphysis region. See here. Here it is symphysis fracture in the midline. Okay, if you will remember the diagram of mandible, the anatomy of mandible, you will know where is the symphysis region of the mandible, and there when the fracture occurs, it is called a symphysis fracture. Now canine region fracture, as the name suggests, it occurs here. Now angle region fracture. This angle region fracture is bounded by anterior border of masseter to the posterior superior attachment of the masseter. Okay, so in this diagram I will show you where is angle region. See this is angle region. Okay, this is triangular portion here. Okay, now ramus region. This is ramus region. Okay, so ramus region is bounded by the superior aspect of the angle and the two lines forming the apex at the sigmoid notch. It is bounded by the superior aspect of the angle to the two lines forming the apex at the sigmoid notch. Now, coronoid fracture. Here it is. This is coronoid, and at this place it is condylar fracture. Again, I am telling you this classification is according to anatomical location. Okay, symphysis at the symphysial region, canine region, then body. Now, relation of fracture according to the site of injury. It could be direct or indirect. अगर इंजुरी से कांटेक्ट है तो डायरेक्ट, और नहीं है तो इनडायरेक्ट, जिसको हम काउंटर कॉप भी बोलते हैं. नाउ कंप्लीटनेस, इट कुड बी आइदर कंप्लीट, ओके, और इनकम्प्लीट. सिंपल. नाउ डिपेंडिंग ऑन द मैकेनिज्म, eversion, bending, burst, and torsional. Now depending on the number of fragments, it could be single, multiple, comminuted. Okay, now involvement of integuments. So if integuments are not involved, then it is closed, and if integuments are involved, then it is open. Now according to the shape and area of fracture, transverse, oblique, butterfly, then oblique surface. Okay, Now, the other three classification will be continued in the next lecture, because we have to pay very much amount of concentration in it. So, thanks.